So excited to share with you the story of Kristy, who almost died while training for a triathlon. And then 20 years later, after a heart transplant, she's finally going to complete it. Welcome, Kristy.
Thank you so much. Thanks to Prednisone for getting me through my transplant.
Yes, it is quite a tale. So, Kristy, let's hear, what is your Prednisone story?
As you said, I was training for a triathlon. I was really fit. This was 25 to 22 years ago. And on my 31st birthday in 1999, I was cresting a hill on my bike. My heart rate went up to 280 beats a minute. I didn't know that at the time. It really freaked me out when I found that out. But I was by myself, 1999, no cell phone. Finally, another cyclist came by 45 minutes later after I was basically fading in and out of consciousness on the side of the road, thinking that was going to be my last birthday. And paramedics came, used the defibrillator pads, and shocked my heart back to a normal rhythm. And I was later diagnosed with what was then a very rare condition. Now, 20-something years later, it's a little bit more common, but arrhythmogenic right ventricular cardiomyopathy is what I had.
Oh my gosh.
Until I got my heart transplant. But it was a long journey. We knew that the disease was progressive. So over 20 years, it was declining. I was declining, but I was able to make it last that long because I was listening to my doctors. I wasn't over exercising. But we got to the point where in probably 2016, I was starting to see the signs of heart failure. Went on for several years, got to the point where I needed to get on the list and was doing that relatively slowly because I was still feeling pretty well. But I just went off a cliff one day. One weekend, I had a really bad arrhythmia. And by Monday, I was in ICU. Tuesday, I was on the transplant list. Wednesday, my heart became available. And Thursday, it was in my body.
Oh my heavens. That is amazing timing.
It was pretty amazing timing. And I know how fortunate I am because many, many people wait a very long time to be able to get their gift. And I was very fortunate that it happened so quickly.
Wow. So that's how you ended up getting a heart.
Yes.
Wow. So I know lots of people are given prednisone to deal with a transplant. So what was that like? Like, what doses did you take? What was your highest dose? What was your lowest dose?
Yeah. So if I recall, I was on 15. I might've been a little bit higher than that when I was in the hospital. I was out of the hospital 8 days after my surgery, and I believe I went home on 15. And I was on 15 for quite a while. And I actually remember one of my doctors said, gosh, you're doing really well. Why do we still have you at this high dose? So they moved me down to 12 and then they started to taper me off. And I believe once I got to 5 milligrams of prednisone, they were at that point able to get rid of my antifungal, my antibacterial, and my antiviral, which is great. So I went from 32 pills the day I got out of the hospital every day until that was a big milestone when I got to cut not only my prednisone down, but also to eliminate some of these other drugs. And now I probably will be on for the rest of my life. I'll be on a 2.5 milligram dosage for maintenance. And there's another anti-rejection drug that they would have put me back on. But honestly, my doctors have said, you're doing so well on prednisone that we probably won't put that other in your system. And let's just keep you where you are and maintain you at a very low dose.
Wow. Yeah. That is fantastic. But 32 pills, like really?
It was pretty frightening. It's funny because I just got rid of 2 more yesterday and I counted today. I'm down to 15 and I'll probably be at 15 for the rest of my life. So 15 is way better than 32.
Way better. Wow. Okay. So if anybody wants to just understand like the smallest part of a transplant, it's 32 pills a day. Like I know it's 32 pills a day, but how often did you have to take them? Because you're not swallowing them all 32 in the morning.
No, and it's really interesting that you asked me that. I remember this was years ago, but when cancer treatment drugs were really coming in vogue in probably the 80s or 90s, I remember seeing a segment on 60 Minutes of a woman who was taking her chemotherapy, and it was probably 20 or 30 pills in the morning at one time. And she would get to like pill number 25 and she just couldn't tolerate it anymore. And she would throw up and had to start all over again. And that was my biggest fear when I came out of the hospital, was recalling that story, thinking, what if I can't take all these pills? So I think I was probably taking 15 or so in the morning. And then I had to take them there was very early morning, then there was morning, and then there was dinner time, and then there was evening, and then there was right when I was going to bed. So it was spread out over 5 times a day. which is a blessing and a curse in of itself. I didn't have to take them all at once, but it was remembering to do all that. So my Apple Watch was buzzing a lot during the day. But as time progressed and as I was, my immune system was getting built back up, and I did have a virus that finally went away, so I could stop taking those drugs. I'm 2 times a day, and the majority of those, I think it's 10 in the morning and 5 in the evening. And unfortunately, I'm a good pill taker, but it's just something that's part of my life now. It's like I brush my teeth, don't even think about it.
That's awesome. I love that you gave the answer to the question I was about to ask. How did you remember?
Yeah, it was definitely, well, and I had this silly this crazy 11-tab spreadsheet when I first got out of the hospital, but I'm now much more contained to what I can hold in my wristwatch.
Wow. Okay. So that is really a great tip. If you're struggling with pill taking, Apple Watch or your phone or whatever can help you remember. Definitely.
I could not live without the reminders. But I do have to say one thing I would love to have your listeners know, and I know you know this because I contacted you about it personally, but one of the things that I really wanted to do after I got out of the hospital was write a book. And it was very much based on me coming home from the hospital and knowing enough about my personality and my knowledge of nutrition and physical fitness that I knew I was going to have a much easier road recovering than a lot of other people who might go back to a cranky wife who didn't want to take care of him, or somebody who wants to go back to smoking or doesn't think that going to rehab is going to be important for them. And it really made me realize that there are varying degrees of people who are ready to be willing and able and capable of taking care of themselves after they got out of the hospital. So as I was writing my book, I came across your fabulous infographic about the effects of prednisone. And my first thing, I put it on Facebook and I sent it to all my friends. I said, I just want you all to realize some of the things that I and people like me are going through by being on this medication. And 15 of my friends either said, I was on it, I'm on it, my dad is on it. And, but they could all empathize. But if you haven't been on prednisone and you don't know what havoc it can wreak on your body and your life and your appetite, on your, mood swings, all of those things. And I was really fortunate. I actually didn't have as many of the symptoms as are indicated in your infographic. But, just to be able to know that I wasn't alone, and that for somebody like me, and I'm going a little bit deeper than you probably intended, but I always had very, very strong body image issues. I was anorexic when I was young. I was exercise bulimic for a while. I just had a hard time accepting my body. And when I got home from the hospital and I looked at, all of it, just, the scars, bloated stomach, these fat knees, my face that I couldn't even recognize when I looked in the mirror. But I'm telling you, being on prednisone and seeing my body in a different way, I won't say 100%, but probably 95% wiped out all of those many years of me worrying about my body image, because I realized that I'm alive, I have a heart, I have a second chance. But I also was able to tell myself, this is not necessarily my body. This is a body on drugs. This is a body that's gone through a lot of trauma. And I just don't worry about it anymore. So I think, probably another thing for some of your viewers and your fans is that we can't control what we have to consume to be healthy. And if we can maybe give up a little bit of how we might look in a bathing suit or how we might feel and what we see in the mirror, to know that, I know in your case, you don't have some crazy allergy and rash, or in other people's cases, to be able to just feel comfortable getting out of bed, or in my case, to be able to get through life without getting every little disease, bacteria, virus that comes in contact with me. It's worth its weight in gold and then some.
Yeah, I love that perspective. Thank you for sharing how you coped with those side effects, because it, as much of a physical battle you had to undergo, a lot of it was psychological. And just hearing the you on the other side, I've gone through this, and the changes in your appearance were worth it because it meant you were alive, that you had a beating heart, even if it wasn't yours, it was a new heart. But you had one, otherwise you were dead, right?
Exactly. There's a running line in my family that a friend of mine coined, which is, I'm now Kristy 2.0. And Kristy 2.0 Has some new parts. It's got some, recycled and refurbished, equipment in there. And I also do have a little bit of, some different appearances, whether it's a scar or just different ways that my body has taken shape. But darn it, I'm alive and I'm doing great. And, as you mentioned in the beginning, I'm now doing things that I couldn't do 20 years ago. I wasn't able to run. I wasn't able to swim. And next month, I won't tell you her age, but my older mom and I are going to be doing this triathlon together. And we're crossing that finish line hand in hand. And that's something I've not been able to do for 20 something years.
That is so inspiring that even after undergoing such an invasive procedure, having your chest cracked open, that if you really take time to recover and go to that therapy and actually take your medication so that your transplant doesn't reject, then there is a life on the other side.
Oh, and it's better than I could have imagined, and it's better than I've been. And I mean, I'm more fit than I've been in 25 years.
Wow. That is so fantastic. I'm so happy for you that there's this other side.
Yeah.
So back to your heart, you mentioned medications and you mentioned all of the ones that you don't have to take anymore. So do you mind telling us what you still need to take?
Yeah. And actually, a lot of what I take is supplements because of, indications of the drugs that I'm taking. But I am on a cholesterol medicine because one of the drugs I take can increase my cholesterol. I'm on my Prednisone. I put everything in my pill case. I'm on my aspirin. I have calcium, magnesium. Again, these are not even drugs. My multivitamin. I just stopped taking this antiviral for this virus I got. I take, the biggest one is my tacrolimus, which is my anti-rejection drug. And there is another anti-rejection drug that they were going to put me back on, but they're going to skip that one. And I think I'm going to be great on my prednisone for the rest of my life. So it's not, most of it is honestly 7 of those pills are tacrolimus that I take every day, 3.5 in the morning and 3.5 at night. So, but yeah, a lot of supplements just because all this stuff, as you know, just wreaks havoc with my body. And I need to counteract it. Yeah.
Yeah, that's for sure. The tacrolimus is a miracle. The fact that you can take that and keep somebody else's heart in your body because you're tricking your immune system into not rejecting it. That is a miracle. And then prednisones are supporting it. So that's fantastic. But then you have to take these other ones to support that one, right?
Yeah. For a while, I was actually on blood pressure medicine that I don't need to take anymore. I was also, when I first got out, one of the drugs that I am still taking it, but for whatever reason, I've been able to control it, has been one that's very common to increase or create diabetes. And so in the beginning, I was checking my blood 3 times a day. And, fortunately, I've been able to control that. So I haven't needed to take those medications. But there's just, there's a lot that when I was going through my pre-transplant phase, just learning, and the day that the pharmacist came in, the day before I got out of the hospital, I've never had my head swimming the way it was with all of the potential side effects. Take it with drug or take it with food. Don't take it with food. Take it with other meds. Don't take it with other meds. It was obviously a lot. But like anything else in life, if you want to be happy and healthy and live a fulfilling life, you deal with it. And again, this is just part of like me putting on my socks every day or, brushing my teeth. It's what I know I need to do to remain healthy, and it's working, darn it.
It is working. Oh, I love that. It's working, and it's like brushing your teeth. It's just what you have to do. I love that perspective.
Exactly.
Awesome. So we kind of talked a little bit about this, but maybe you have more thoughts of what would you tell people prescribed prednisone in general or specifically for a transplant? What would you tell them to expect?
Yeah, I think really it is that whole, well, it's probably 3 things. It's the physical changes, and those physical changes will dissipate as you start to come down on your dosage, which happens with, at least in transplant patients, it happens with most. I won't say all, but most. Many transplant patients after a year don't take it at all. Like I said, we just found the right combination for me, so I'm going to be on it for life. So the physical piece was probably the biggest one, but know that many of those are short-lived. I think the second is the insomnia. And that was one I'd always been the best sleeper. And my husband was so jealous of me, and my head would hit the pillow. I wouldn't move. The cats slept on me because they knew I wouldn't even budge. And they just knew they could nestle up for the night. That was a really, really new thing for me, to wake up at 3 a.m. and be awake for many hours. So, dealing with that and just learning ways to be able to get myself to calm down, to do, I have meditation apps that I would allow myself to just listen to and fall back asleep. But again, as the dosages came down, that rarely happens to me anymore. And then this didn't happen with me, but I know it happens with a lot of people, is the weight gain. And I think that's one thing to just really work with your doctors. If you are able to, meet with a nutritionist, hire a nutrition coach. I think those are great tools to be able to keep that excessive weight at bay. I've never really been a huge snacker. I'm a portion control person. I always have been. So I never did have that weight gain issue. But again, my body just looked different. I mean, my scale didn't necessarily say it, but if I looked at myself, I thought, gosh, I must be at least 5 pounds heavier. But I mean, it was just the way, the fluids and the way my body was reacting to the medication. So I think that's one, again, I didn't struggle with it, but I know it's a real issue for a lot of people, is the weight gain and the eating, and that, constant feeling hungry and snacking. And, it's easier for me to sit here and say, don't eat. So I'm not going to say that, but I think there are ways around it. To work with someone or get on a plan that will help you try to hold back on some of those calories.
Yeah. Fantastic advice. I agree with everything you just said. That is great. So you said you're not a very snacky person, but you had to eat something. So what was your go-to snack or food or meal that you would eat while you were recovering and taking prednisone?
Yeah, well, and it is funny because it was different when I knew I could potentially be having to get insulin shots if I didn't watch my blood sugar for diabetes. I got a lot more disciplined. So I have always loved ice cream. I've always loved cookies. I love sweets. I absolutely love sweets. And that was where I just had to say, I know my body will react better to a piece of fruit. And I love produce, and I am a very healthy eater, but it was hard for me to say, rather than sticking that ice cream scooper in the container and get myself a small bowl, let's have a tangerine instead. So for me, it really was partly because of the threat of diabetes, but partly because, again, I'd been, researching enough to know that this can be a real issue, that there could be a lot of weight gain on prednisone. So it was a lot of fruit. And then just finding things that weren't very, carbohydrate rich, which again, can also increase your weight more so than other foods. So I was just a little bit more careful, but I still did snack, but I've always been, and if this helps your listeners, great. But my mom taught us when we were very young that when we were done with dinner, and we did always get dessert, but when we were done with dessert, the kitchen was closed. And I just don't eat after dinner time. I never have. I grew up that way. So if there's a way that you can train yourself to close the kitchen, she would say, the kitchen is closed, that I think that helps too, because the later you eat, oftentimes that can even wreak more havoc on the weight gain. So if you can try to avoid snacking after dinner time, it's certainly helped me.
Oh, yes. Yes. Because the thing about the prednisone hunger is that it's giving you false signals of hunger and cravings, and it's just tricking your brain into thinking things that aren't real. Mm-hmm. And so if you can put barriers in place like that, the kitchen's closed when we're done with dessert, then it's closed. And even if it's 2:00 in the morning and you wake up with that insomnia, the kitchen's closed. So it's just making yourself have those boundaries and keeping them in place. And then, like you said, you can deal with it.
And it's, again, I go back to the easier said than done. I mean, I think one of the things, and I write about this in my book as well, but I think one of the things that I've always been a big proponent of is don't make drastic changes too rapidly. And so if what you just said, Dr. Megan, is, okay, I'm going to now say the kitchen is closed. Well, maybe it's the kitchen's closed Monday, Wednesday, and Friday. And on Tuesday and Thursday, I can still have a couple snacks, but they should be something healthy. And then the week, next week, then it's going to be 4 days. I mean, so I do really believe that we're all bound to fail if we try to do anything cold turkey. And if it's probably worth gaining a couple extra pounds and not setting those boundaries day one as an absolute. kind of ease yourself into it, and then you probably have a little bit better chance of success. It's just been my experience.
Do you hear all the wisdom coming out of this woman? She is like, if her book is anything like how wise she has been in this interview, then we all need to go get her book, because like, this is just a taste of what she has to share.
Thank you.
So where can we find you and the book and everything?
Yes. So I do have a website, www.changeofheartmemoir.com. The name of my book is Change of Heart: My Journey of Transplantation, Revelation, and Transformation. And it's in pre-sale until the 1-year anniversary of my transplant, which is March 11th of this year. But it's pre-sale now, so you can get it through my website. And then on the 11th of March, it's going to be in 38,000 online retail bookstores, which blows my mind.
That is amazing. I love the name as well, Change of Heart, because that has so many levels. That you physically had a change of heart, but I'm sure there was more to it. I mean, at the very least, you were just telling us about your acceptance of your physical health. Yeah. So I'm guessing there's more to it than that.
You'll have to read it and see. Yes, no, absolutely. I mean, and really the impetus for the book, again, was this whole concept of these other patients going home and wondering what they were going to be going home to. But, you know, I would have people tell me 3 weeks, 5 weeks, 10 weeks after my surgery, there's no way you just had a heart transplant. You look so healthy. You must have gone into this, you know, physically well. And I said, yes, I was, I mean, as well as I could be in 5 years of heart failure, but I also had paid a lot of attention to other dimensions of wellness. And so the back part of my book is about what I call my wellness widget, which is really focusing on 6 dimensions of wellness. And if we can get our social wellness a little bit more healthy, or our vocational wellness a little more healthy, or financial or spiritual, you know, we're never going to be perfect in all of them, but sometimes you fix one and it automatically fixes another. So that was really a big thing for me, was just to realize that going into this, I was relatively healthy in a lot of areas. And, you know, we're all going to face trauma at some point. We're all going to have something that we're not prepared for. And if you can get ahead of it and you can sort of preform to transform, I guess is the way I look at it. You know, we could all use some little extra help on the front end for something that could happen to us later.
Yes. Oh, the wisdom just keeps pouring out. I love this. So you can get her book pretty much anywhere books are sold, and find her at changeofheartmemoir.org.
.com. Changeofheartmemoir.com. Mm-hmm.
.com, and find out more about this. I'm so intrigued about this wellness widget. And that sounds like something that we all need at the very least to cope with any health concern, even, you know, from heart transplant to what I was dealing with.
Yeah.
Having that wellness foundation in place.
100%. Well, I am so grateful that I found you. Again, if it were not for that infographic, we would not be talking today. And it was a great wake-up call and resource for me, and something that I have shared with others. And obviously it's in my book. So you've made a big impact on me, and I really appreciate it.
Well, you're so welcome. And here's the funny backstory to that. We were driving home from Thanksgiving, and I was sitting in the back seat with the iPad with my kids, and I was drawing this picture, and I showed it to my husband. I'm like, look, it's me. He's like, what is that? And I was like, this is what it felt like to be on prednisone. He was like, you're not going to share that with anyone, are you?
Yes, you did.
So I did. And it has helped a lot of people, because that's really what it feels like. It's not like prednisone isn't just one part of you. It's all of you that's being affected. And so I'm really excited to hear more about how your change of heart happened and how we can all have a similar change of heart. So thank you.
Thank you, Megan. I really appreciate the time.
All right. Signing off is Dr. Megan, your prednisone pharmacist. If you want to hear more stories like this, just check out other prednisone warrior stories who can inspire you along your journey as a prednisone warrior.